Welcome to our podcast where learning becomes change, the community of practice model held as part of the dissemination of Qadam project. Today we will explore how communities of practice can turn shared learning into meaningful change. I am pleased to join by our distinguished panelists. We have Dr. Zahir Gul with us, Dr. Yasmin Kazi, Ms. Mariam Nawaz, and last but not least, Dr. Zeb Dahar. So let's begin with Dr. Zahir Gul. Dr. Gul, when we talk about community of practice, how is it different from other technical forums and technical working groups?
It's a very good question. And there's a nuance between the two, you're absolutely right. लेकिन जो स्टैंडर्ड टेक्निकल कोऑर्डिनेशन और दूसरे फोरम्स होते हैं वो कोई स्पेसिफिक एजेंडा लेके चल रहे होते हैं और उसमें उस एजेंडा पे डायलॉग कंसेंसस agreeing on what needs to go into it. That consensus building is a critical function of any technical coordination forum. And there may be other objectives attached to it as well. Community of practice जो है वो it's yes, coordination is a very critical part of it, and that's one of the goals, but it goes beyond that. The community of practice approach is more of an intervention at the group level, at the institutional level. So when you think about changing practices or behaviors, I mean, interventions can take place at any number of different levels. For example, your campaign might look at individuals and their own individual behaviors that they do for themselves. Your interventions could look at a household, perhaps, where the household is engaged in a manner where household norms are shifted. You can work at the community level. At the institutional level, we have different organizations and we have different types of individuals who are supporting the system in designing, developing, implementing, and evaluating any number of functions for any particular discipline. The community of practice is approached and viewed as an intervention to modify practices and decision-making mechanisms for a particular discipline among the practitioners of those disciplines. So a very simple example might be having a medical association of doctors or having an association of family physicians, and we have those as well. The PMA and the Family Physician Association are very important sort of platforms. What these associations really do is they bring together practitioners to discuss, agree on, and implement newer ways of working. And fundamentally, in a community of practice, what you're doing is you are trying to establish a new set of norms of practice for that discipline. So, for example, if there's new evidence that is coming in, somebody may read it, somebody may not read it. Somebody may understand it, others may not understand it. So what a community of practice would do, it would package that information, that evidence, it would disseminate it to its members so that everybody is on the same page. Similarly, the community of practice, in a vein similar to the coordination platform, may bring together different practitioners working in the same space and engage them in a consensus focused mechanism to decide and discuss what are the priorities for the discipline from the practitioner's perspective.
So if I ask you कोई एक challenge आपको face करना पड़ा हो for forming the COP and onwards.
In the development sector, a lot of the work that takes place within time-bound donor-funded projects. Donors may be domestic, they may be foreign, but it works in time-bound projects, which means that any institution that is accountable to the donor for completing their outputs and outcomes in time, that remains their first priority. Which means that different actors and different timelines and different mandates, getting them together to engage voluntarily outside of the project deliverable is a challenging task. Not because people don't want to, but because they have other priorities and commitments. So there's that time issue which is critical. Incidentally, when we started, it was all in lockdown. So a lot of the work that we initially did was through virtual meetings. Of course, post-lockdown, since we started engaging more personally, I think my colleagues at Pathfinder will be able to vouch for this. Just getting a date to get everybody in that same place is perhaps the biggest challenge in organizing an effective community of practice. And of course, how we overcame that was to have these champions and influencers within the SPC space who could potentially nudge people to prioritize this within their busy schedules. And I think once we got over that, it started moving forward, but that challenge remains and it's not going to go away.
Thank you, Dr. Gul, for the fruitful discussion. Dr. Yasmin, how do we measure the success of a community of practice?
The community of practices is bringing different practitioners together, and it's about different organization which may have a common kind of a mission in the sense of women's reproductive health or anything, but they have a quite diverse niches and abilities. So I think in order to measure the success, it's important that the community of practitioners are aligned on a single pathway, which is the work of the secretariat and the leadership and the leaders who are running it. And you say that the partners are aligned; they have similar understanding that what does it mean, why it is important, why are we part of this. Then the other thing is the openness to share their resources, and so creating a knowledge management portal, something that they are open to share. And then not only sharing, but how does the practitioners coming together and taking advantage from all these resources, and then coming out with a kind of a differently aligned modules or something that they can practice. And then when we see that hitting the ground, that these are the knowledge management products, these are the behavior change strategies, and we see that it does result into a behavior change, we see a larger impact around that, people are better understanding it, and then it is making that shift that we needed to. So these are the kind of things, and when I say it's not only material resources, uh, I know this is a at this point in time everybody has a funding crunch, but even sharing the financial resources for strengthening the community of practitioner would be a success milestone, and would be something that would contribute to the to the impact that we are trying to create.
And from a systems thinking lens, what enables the COP to influence institutional behavior?
Then it has to be at a stage that we are able to have very strong practitioners community who are able to work on a common themes, and who are able to work on a kind of a modules that they all feel are going to be impactful. And how do we take it forward and present it to the public sector, because that is where the largest impact would happen. And to pass it on to them and have create that kind of a public private partnership model, but enabling them and building the capacity of the public sector system to use the community of practitioners model, not only to run it on their own, but also to share the knowledge management partner, which is like open resource, which is something that the larger field can benefit from. And this would be something that will say now it has an institutional strength. And also I feel from the experience that we have had, because it was very organic, we started working on it during COVID, and at that time it was very iterative. It evolved on its own because we felt that we need to work on it. And then, of course, when the COVID was over and we needed some financial stability, then we know that it cannot happen just on a very voluntary basis. It needs funding. It needs some kind of a committed team. And then, of course, there are always leaders and others, experts who can come in and give their time because they're committed.
Thank you, Dr. Yasmin. And which brings me to Mariam Nawaz. Mariam, how can a community of practice move beyond sharing information and more towards actually influencing the policy and programming?
Thank you, Ali, for inviting me for this podcast. I'm very honored to be here. Um, so this community of practice has a wealth of resources, and I believe that जितने मैसिव रिसोर्सेज इस कम्युनिटी ऑफ प्रैक्टिस के पास है, इट हैज़ द पावर एक्चुअली टू बिकम द एजेंट ऑफ चेंज, नॉट ओनली अ लर्निंग ग्रुप. मुझे लगता है कि इफ rallying voices and joining forces and then setting a common direction, and that common direction is obviously already set, sustainable development goals हैं, ICPD है, and then this is the decade of action. But the question is, how can we do it? We can do a lot of things, but if we set our direction as a community of practice, if we set our direction in the direction of national priorities and set common goals, for example, there is a discourse going on National Finance Commission, the NFC award. If the community of practice comes together and align the voices and the campaigns and the resources to support the advocacy on fiscal incentives for reproductive health and gender-based violence, and indicators on gender equality, then a lot can be achieved together. I understand at the same time, जैसे मेरे साथी जाहिर हैं, उन्होंने भी कहा कि डोनर फाइनेंसिंग होती है प्रोजेक्ट्स की. तो जो डोनर, मूविंग अवे फ्रॉम डोनर फाइनेंसिंग एंड मेकिंग इट सस्टेनेबल, ऑफ कोर्स वी नीड द सपोर्ट ऑफ द गवर्नमेंट. So this community of practice at the same time can work as an incubation center or an incubator for innovation. We all do, my colleagues here, we all the members of the community of practice from UNFPA, UNICEF, Pathfinder, and all the other esteemed organizations, all the development practitioners. We are doing a lot of campaigns, a lot of initiatives. If we rally voices and bring together a common direction and then implement projects, those projects which are then backed by data and evidence, we produce policy briefs, move away from traditional means like brochures, and then provide together some actionable recommendations in those policy briefs.
Thank you, Mariam. And also, how do you think that the COP can strengthen the technical capacity in SBC across provinces?
आई थिंक दिस कम्युनिटी ऑफ प्रैक्टिस इज, अगेन मैं बार बार कहती हूँ कि बहुत अच्छा प्लेटफॉर्म है लर्निंग का, एक्सपीरियंस शेयरिंग का. इस ये कम्युनिटी ऑफ प्रैक्टिस एक एक्सपीरियंस शेयरिंग प्लेटफॉर्म बन सकती है अली, फॉर द प्रोविंसेस. मैं एक मिसाल देती हूँ कि जो हम बहुत सारे फ्रेमवर्क्स डेवलप करते हैं कम्युनिटी ऑफ प्रैक्टिस में, बहुत सारे एनालिस्ट हैं, एक्सपर्ट्स हैं. That learning can actually go to the provinces. The provinces can also be brought together with the use of community of practice to share learnings. For example, child marriage पे कुछ provinces आगे जा चुके हैं legislation में, और कुछ अभी उस पर काम कर रहे हैं. तो मिसाल देती हूँ सिंध की और बलोचिस्तान की. We can bring together Punjab and KP and learn from each other on and exchange lessons, and then do brainstorming on what the provinces can do together and what can be achieved with the help of social behavioral change experts. क्या actionable recommendations हैं, क्या वो concrete ways हैं जिससे social behavioral change trigger की जा सकती है on actually these sensitive issues such as reproductive health, such as uptake of family planning, child marriage, gender-based violence, and so on. अच्छा, इसके साथ साथ what I believe is that जो डिजिटल टूल्स की लर्निंग है, कम्युनिटी ऑफ प्रैक्टिस के पास बहुत वेल्थ. डिजिटल टूल्स, अगर प्रोविंसेस और प्रोविंशियल पार्टनर्स को डिजिटल टूल्स के ऊपर ट्रेन किया जाए और सोशल लिसनिंग पे ट्रेन किया जाए एट द कम्युनिटी ऑफ प्रैक्टिस, फॉर एग्जांपल हम उनको सोशल मीडिया एनालिटिक्स पे बताएं कि हाउ टू लिसन टू द सेंटिमेंट ऑफ द कम्युनिटी and do the real time analysis, and at the same time then adapt the messaging. जैसे अब मेरे साथी उन्होंने फरमाया कि एक वन साइज डज नॉट फिट ऑल, तो हर प्रोविंस के साथ एक टेलर्ड डेडिकेटेड एफर्ट की जा सकती है एट द कम्युनिटी ऑफ प्रैक्टिस.
थैंक यू मरियम नवाज, थैंक यू सो मच. सो डॉक्टर ज़ेब, सारा अमेजिंग काम जो इन्होंने बात किया है सीओपी का, वो आपकी स्टूवर्डशिप में हुआ है सिंस यू वर द प्रोजेक्ट डायरेक्टर फॉर कदम ब कदम. सो हाउ कैन यू इंश्योर कि जो सीओपी की लर्निंग्स हैं वो ट्रांसलेट हो सकें एट द प्रोविंशियल एंड डिस्ट्रिक्ट लेवल?
सो एसबीसी के लर्निंग्स को किस तरह से आगे लेकर जाना है, जैसे डॉक्टर यास्मीन ने भी कहा कि it's a journey, and we learned, and it is evolving journey. हमने खुद सीखा कि किस तरह से इसको आगे लेके जाना चाहिए. काफ़ी सारे चैलेंजेस आए, फंडिंग चैलेंजेस, और स्पेशली जब ये प्रोजेक्ट बंद हो रहा है तो हमें लगा कि हम इसको बीच में ना छोड़ें, बल्कि वी started talking to the partners which have funding available for SBC, discussed with UNICEF, and they graciously agreed कि उनके पास जो एनुअल वर्क प्लान है SBC के हवाले से, वो इसको टेक ओवर करेगा और इसको आगे लेके जाएंगे SBC की लर्निंग्स को.
Thank you, Dr. Zaib. Thank you, Dr. Gul, for the fruitful discussion. Thank you to the virtual participants for joining us. I'm sure there was a lot of learning in it for us. We will catch you next time.